A blood clot is a normal body repair process and often has no consequences, but there are situations where they form when not needed. This makes detecting warning signs much more important. Today, with the help of some experts, we'll provide you with the key warning signs of a blood clot. But before we dive into that, why not click on the subscribe button and enable the notification bell as well, because we are the best place on YouTube for all your health tips needs. Alright, let's move on to blood clots. Blood is constantly flowing and moving throughout the body. The heart pumps it through your arteries and then it returns to the heart. Without constant movement, blood can become stagnant, resulting in clots. But before we get into the warning signs, risk factors, and prevention of blood clots, we need to talk about deep vein thrombosis. Deep vein thrombosis, or DVT for short, is the term used when a clot forms in one of the major deep veins in your body. Most often, this will happen in your legs, but it can also occur in your arms, pelvis, lungs, or even in your brain. At least 900,000 Americans are affected by these events every year. These are the most serious blood clots and should be examined immediately by a medical professional. Now that we've discussed deep vein thrombosis, let's move on to the rest of our guide on blood clots. Before we look for warning signs, we need to ask ourselves, what are the risk factors? Risk factor number 1. Age, especially if you're 65 years or older, you are much more at risk of a blood clot. Stay vigilant for these signs if you're elderly. Risk factor number 2. Travel, especially long journeys like any trip that has you sitting for more than 4 consecutive hours, makes you much more susceptible to a blood clot. Try to keep the blood flowing at all times, even if you're on a plane. Walk down the aisle and, well, try chatting with other passengers. Risk factor number 3. Lying down, bed rest, or being sedentary for long periods of time makes you much more prone to having a blood clot. We know how awesome it is to sit and watch Netflix for 8 hours a day, but try to move around at least a little. Risk factor number 4. Being overweight. Obese people are very prone to blood clots. If you're thinking about changing your weight, we here at Bestie have lots of cool videos on weight loss and diet. Risk factor number 5. Being pregnant. Pregnant women are incredibly susceptible to blood clots. Risk factor number 6. Lineage. By this, we mean if you have a family history of blood clots, make sure to talk to other family members to see if they've ever dealt with them. If so, talk to your family doctor. Risk factor number 7. Smoking. Smokers have a higher risk of having a blood clot. If you smoke, quit, or at least, cut back significantly. Risk factor number 8. Contraceptives. Turns out certain contraceptives can cause or at least contribute to blood clots. Talk to your doctor about what the side effects of your pills are. Okay, now that we've discussed the risk factors, keep watching to see what the main warning signs of blood clots are. Warning sign number 1. Swelling. If a clot forms in your arms or legs, deep vein thrombosis, you may experience swelling. DVT is more likely to occur if you've had surgery, don't move frequently, or have been on a plane for a while. Warning sign number 2. Change in color. If you notice an area of your body becoming itchy or turning red, blue, or having a red line, you may have a blood clot. The change in color suggests that the area is sensitive and swollen. Warning sign number 3. Pain. Your limbs need circulation to move. When it's interrupted by a blood clot, it can cause inflammation, which leads to sharp or severe pain in the affected limb. Warning sign number 4. Breathing problems. This may mean the blood clot has moved from your arm or leg to your lungs. You may experience a strong cough or even cough up blood. Dizziness and chest pain are also signs. If this happens, seek medical treatment immediately. Warning sign number 5. Accelerated heart rate. When you have a blood clot in your lungs, your oxygen flow decreases. This causes your heart rate to accelerate to compensate for the slow oxygen flow. Warning sign number 6. Speech or vision problems. A blood clot in the brain can be caused by fat deposits on the walls of blood vessels that deposit blood in your brain. This can cause vision and speech problems, seizures, and weakness. Warning sign number 7. Nausea or vomiting. A blood clot can occur in our veins that drain blood from the intestines. This can cause nausea, vomiting, blood in the stool, diarrhea, and stomach pain. Warning sign number 8. High blood pressure. If you have a blood clot in your kidneys, it can prevent them from removing waste. This can cause kidney failure or high blood pressure. You may also feel feverish, see blood in your urine, have difficulty breathing, and suddenly swell in the legs. So, finally, let's ask ourselves, how do we avoid having a blood clot? Well, Luckily, we've consulted a myriad of sources to teach you the ins and outs of preventing blood clots. Prevention tip number 1. Wear loose clothing. As we've mentioned, blood needs constant movement to avoid clotting. One way to keep blood flow going is to ensure your clothing doesn't restrict any of your limbs, especially your legs. We know you love wearing those tight pants, but maybe restrict that to once a week. Prevention tip number 2. Elevate your legs. You should elevate your legs 6 inches above your heart occasionally. This will help move the blood around a bit and, best of all, prevent it from clotting. Prevention tip number 3. Exercise. Everyone compares exercise to getting the blood flowing. Yoga and deep breathing exercises are great ways to increase circulation. Over time, walking can also strengthen your heart and improve overall cardiovascular health. We can also assure our viewers that exercise, in general, is great for blood circulation and thus great for preventing blood clots. Prevention tip number 4. Change your position frequently. We briefly mentioned this in the risk factors, but if you're sitting or standing for a while, you should change positions. This will get all the fluids that keep your body running moving. You should never sit or stand for more than an hour. We know you might look silly jumping up and down every 60 minutes, but it's better than having a blood clot. Prevention tip number 5. Eat less salt. There's a correlation between poor circulation and salt consumption. Excessive salt intake can also increase artery stiffness and cause ventricular hypertrophy or an increase in heart muscle tissue, making the heart pump with less force. So, just cut back. Prevention tip number 6. Protect your legs. We already know your legs are in greater danger, especially when it comes to deep vein thrombosis. So you'll want to protect those babies at all costs. Do your best not to bump or injure them, and especially don't cross them. Either way, you'll be cutting off circulation if you cross them or concentrating too much blood in one area if you bump them. Just stay vigilant and be careful. Prevention tip number 7. Quit smoking. Smoking increases the risk of unwanted blood clots and makes it more likely for platelets to stick. Smoking also damages the lining of blood vessels, which can cause clot formation. Overall, just quit smoking. If you need help, there are plenty of resources online, and if you're really struggling, ask for help from your friends and family. And that's pretty much it. We hope you've learned a lot today about blood clots, especially about how to avoid them. But did we forget anything? Are there blood clot specialists out there who would like to share their advice with your fellow viewers? Let us know in the comments section below. Anything you know about blood clots, from your experience to your tips on avoiding them. Liked this video? Click like, share, and subscribe to Active Health. Wait, what kind of healthy would we be if we didn't tell you about our other awesome videos? Go ahead, pick the video on the left or right and enjoy.